Thank you so much for joining us today. My name is Takani Chambo. I am the Volunteer Engagement Specialist for Global Care Force, and I'll be serving as your host for our Discover Online conversation. So the purpose of this is just to give you a high-level overview of who Global Care Force is, what is it that we do, and how you can get involved, as well as to hear some stories from our amazing volunteers, Guy and Marilynn Fiocco. Just to get started, a little housekeeping. This volunteer discovery discussion is being recorded. I will email all of you afterwards with a link to the recording, as well as a link for you to sign up to volunteer if you're interested in joining us in that way. There will be a question and answer session at the very end of the call. So if you could please hold your questions until then and keep your mics muted. If you're worried that you'll forget your questions, then feel free to type it in the chat for this call, but there will be a time for that later on. So just to give you a idea of what Global Care Force does and who we are, we have the mission and purpose to transform lives through volunteer service by connecting volunteers with organizations that serve people worldwide. And our volunteers serve people without distinction and with respect for their cultures and their faiths. Our goal is to continue to provide primary care teams to those locations that have little to no access to health care, and we are a 501c3 registered nonprofit. We serve all over the world, so we send medical teams to Egypt, Jordan, and Ukraine. We send medical and non-medical volunteers to the southern border, particularly at El Paso, Texas, and we also send non-medical volunteers to various missionaries of charity sites in Gallup, New Mexico, in Rosarito and Tijuana, Mexico, and San Francisco. Today, we have the privilege to hear from two of our amazing volunteers, Guy and Marilynn, who volunteered with Global Care Force quite a few times. Thank you so much for taking the time to meet with us. Just to get us started, Guy and Marilynn, can you please tell us who you are, what you do, and how you got involved with Global Care Force?
I'm Marilynn Prince-Fiocco. I am a retired pulmonologist. We've been living in Wilmington, North Carolina for 10 years and worked here for several years before retiring. Before that, worked in primarily hospital environments in both Wisconsin and Texas. Guy can tell you more about how we got involved after he talks about himself.
So I am Guy Fiocco. I'm a retired rheumatologist, and we met up with Global Care Force before they were Global Care Force. We actually retired and decided to do some volunteering, and at the time it was the COVID epidemic, so we ended up going to the Navajo reservation on our own. And there we met up with members of COVID Care Force, which eventually became Global Care Force. And we've been with the organization ever since. I mean, the people on the team for COVID Care Force and the organization itself were so inspiring that when they said they were going to Ukraine, we said we'd love to be a part of the teams there.
Oh, thank you so much for continuing to be with us from the very beginning. You mentioned a few locations, so can you tell us where you volunteered with us and what made you interested in volunteering there?
Well, we had gone back to the Navajo reservation while it was still COVID Care Force, so we were involved with the organization. In places we've been, we also had done some work previously at the Texas-Mexican border with another group. So we had some interest and knowledge regarding that situation. So we've also been to El Paso when that came up. But I think we were involved right away with Ukraine, not in the first group, but in a group shortly thereafter, with the recognition that the situation there was unlike anything we had been involved in before. And because we did trust Global Care Force from their previous work in the organization to have both the mission and the means to have a meaningful experience. We wanted to go to Ukraine at that time.
Awesome. And can you share a story of maybe it's a person you met or something that happened one of the times that you were volunteering that will just stick with you for the rest of your life?
Well, there are a lot of stories. I mean, we heard stories of the patients we were taking care of who had literally spent months in their basements during the Russian occupation of their village. Um, and the gratitude that they showed us when we were there. But in particular, I think one patient I will not forget is a very elderly woman who bicycled her way to our clinic. She had severe arthritis, and I was able to inject her knees. And she got up, walked around the room, and thought they felt so much better. She came over and gave me a big hug. And I'm not sure I've experienced that kind of any American patient that I've taken care of, but it is something that'll definitely stay with me.
That's beautiful. And Marilynn, do you have any story that has stuck with you?
You know, I think the volunteers, the translator volunteers we worked with over there were continuously inspiring to us, and we will remember that forever. In terms of some of the sorrowful experiences, recognition of I'm remembering a woman who came in and complained of her back pain, and her problem in this middle-aged woman had her back pain had gotten worse when she was digging graves for soldiers, and just recognizing in so many people the loss that they have experienced in so many ways. We were together as a group one evening in one of our small towns when the remains of a Ukrainian soldier who had been killed came back, and the whole town came out and was on their knees.
Wow, that's yeah, our volunteers see very intense suffering, and I think it's really beautiful that you give of your time and your resources to go and meet people in that and let them know that they're not alone and get to be a part of each other's stories in that way. So like I mentioned earlier, both of you have been in quite a few of our locations. So I will ask about Ukraine specifically. Can you please share what a typical day in the life of a volunteer on the ground in Ukraine looks like?
So a typical day usually starts out, we all get together and have breakfast, talk about which village we may be going to that day. Um, we get in the van. We get in the van. Some of us help load the van. There's usually two vans, one full of the medications and one with the team members. Drive to the clinic, set it up with the pharmacy and the rooms that we're going to be using. And then, we start seeing patients. But the one thing I remember very vividly is that we're willing to interact with the other team members while seeing patients. So if there was something that looked unusual or we weren't familiar with, the other team members were there to run it by them and see if they had seen this before. Um, when clinic is over, we pack it up and go to our hotel for the night, and then we all have dinner together. And again, we can go over what we had seen that day. And
I think one thing that is sticks with us regarding each day as a volunteer is, although we get up early and arrive at the clinics, which are often makeshift buildings that have been used for other things, we have a line of people who are waiting, and always waiting patiently as we set things up. And we don't leave until we're finished with that group. So we try to be efficient and take short breaks, but the recognition is that the day is a little hard to predict because we stay until we're done.
And Guy, you touched on this briefly when you mentioned the team. We've noticed that our volunteers often come together as strangers and they leave as very good friends. What would you say your experience of teamwork has been as you volunteered with us?
Oh, there's no question that we all bond almost immediately once we formed a team. We all meet in Krakow for the American part of the team, get to know each other there before we take the train ride into Ukraine. But it's the really the camaraderie at breakfast and at dinner and during clinic that we learn about each other. We exchange differences in the regions of the country where we live. And then, just the Ukrainian part of the team, we can see differences in our foods and our policies, and it's just a great educational experience to form this team that we do.
Right, the interaction with our translators, because we're provided individual translators, is really a unique part of this organization. And we've had the good fortune of meeting them several times, several of them who, continue on each of these trips. And their English is excellent. They're very patient with us. Most of them are not originally medical, but their experience and professionalism and courtesy and kindness and compassion in dealing with the patients who are their, countrymen is, maintains just an unusual atmosphere of cooperation.
And I'm going to switch focus real quick just to the southern border. What does a typical day in the life of a volunteer in the southern border look like?
Well, that's a little different in that when we are there, in our several times being there, we are the whole team, maybe with an additional provider. And we arrive early in the places where the asylum seekers are staying, and which may mean a large gym with cots or without cots. And the part of the difference is in, there are primarily families. In Ukraine, almost everybody is elderly because the children were taken away, early in the war. In El Paso, these are families, and they, again, may be lined up to come see us, but we bring our medications with us, we set up, and again, we just see lines of people until we're done, and then we're more on our own in terms of our own meals. Lodging is provided, but we're up early. We go back and we stay late, and it's a different kind of group of patients.
So the teams are smaller, and we usually have a translator there as well. But it's not. You can see the picture of the size of our team in Ukraine. In El Paso, it's usually about 4 or 5 people that make up the team.
Well, in El Paso, actually, we send individuals or couples like you and Marilynn, and then you would have your translator on the ground. So you're right in saying it is much smaller. But is there any story of a person or something that happened while you were volunteering at the southern border that has stuck with you?
Well, I don't know if it was one story, but it was many stories. A lot of the refugees who made it over will share their trip from where they came from, whether it was Venezuela or whatever country they were trying to escape from. And they tell you the horrors that they went through to travel that distance to get to El Paso. And it's one story after another about this incredible journey that they took to get there.
Yeah, it is quite incredible what people go through as they're trying to seek better lives for themselves and their children. sometimes when you come back to your normal life after you've been volunteering for a while, it can feel like quite a shock to your system. How has your time volunteering in all these places that you've been to, how has that changed and shaped your perspective and the way that you approach your life now?
I, I think from both experiences is much more than the people we associate here in the United States is the perspective that this could be us. You know, we're dealing with refugees, and they're refugees around the world who have endured challenges that are no fault of their own, and there's, I think, a belief here in you know, the division of them and us. And my feeling is that we could become that them, you know, very, very easily. And it's what makes you continue to serve from America is to recognize that the air raid sirens we hear there in Ukraine could become the, you know, what we're hearing here. So it's I think that recognition of unity with the people that we're serving.
You know, the other thing I noticed when you come back and you feel like you've actually accomplished something, and you're home for a short time and you're sitting around reading a book and thinking, you know, I should be out there helping other people instead of sitting around reading a book here. It really makes you want to go and do more volunteering.
We've just been very fortunate and continue to want to share that. And I think the realization that so many of us here are fortunate in ways you just never think about.
Absolutely. And we're so grateful for your heart for volunteering and that we're going to have you with us in Egypt next year. I'm sure you'll have amazing stories about your time there as well. This will be my last question before I turn it over to the audience, because I'm sure they have questions for you as well. In your eyes, what impact would you say Global Care Force is making as a whole?
Well, when you see the patients after they've been taken care of and the gratitude that they show you, you know, it's hard to imagine that you could be doing any more good than that in a country that is really under such stress, and these people are, um, you know, just basically surviving, and you're able to help them just a little bit. Uh, I think, you know, you have to give it to Global Care Force for taking the initiative to get out there and do this good.
And each time that we've been there, you know, we talked about the bond that we form with other volunteers. One initial linking factor is simply the fact that we're all there with that same um, feeling and same motivation. And I think part of the benefit of Global Care Force is the way that we as volunteers can return to where we live and share that perspective on the world to hopefully increase people's understanding of humanity, even in people we're not directly working with.
Thank you so much. And now I'm going to open it up. Does anyone have questions for Guy and Marilynn about their volunteer experience?
Can you hear me? I'm Chris Adamson.
We can hear you.
Yes.
Okay. Can I ask? Well, one of the questions I had, I've done five, I think, South America and Central America missions, medical missions. And during that 5 trips, I accumulated knowledge about who I was seeing and what kind of cases I was seeing. And I was able to develop a medical kit that was more, that was more directed towards the cases that I was seeing. So the question is, you've been to Ukraine a few times, it sounds like. What kind of cases could I be prepared to see? I mean, I know it's primary care, but inevitably there's, interesting cases and I'm an emergency-based kind of person, so I'm sure there will be cases that, we could, help out at that time. In other words, there might be an illness or injury or something like that that could be addressed. So
I
that's my
think
question.
preparation you'll use your previous skills, because especially in Ukraine, now we're relatively elderly, we're retired at this point, but the primary focus will be on diseases that go with aging, with
Okay.
neglect, musician of and extremely high blood pressures. Um, the culmination of some years now of poor nutrition, inability to have the testing and follow up and medications. So you're really looking at um,
So
hypertension,
ba-
anxiety, and to some extent heart
basically we
disease and
see
arthritis.
arthritis, hypertension. There's a lot of thyroid disease, um, diabetes, and PTSD are really most of what you see.
Okay.
And of course, you're operating without benefit of laboratory studies or X-rays, and that, to some extent, we're proud of ourselves for being able to work without those, but it can be a little unsettling that you don't know what someone's potassium or blood count is, but you work without that and rely on your physical exam skills.
Okay. Fair enough.
I have a
Thank you.
question. Sorry.
You
Thank
can
you
go
so much
ahead.
for this. Appreciate it. My name's Carrie. I've done global health for many, many years. And the most, a couple of years ago, I was supposed to go to Ukraine, and I, at the last minute, said no. And the question relates to safety. It turns out the guy that I was going to be working with was killed and bombed in Bakhmut. It was on the front page of the New York Times. And I was lucky that I didn't go at the last minute. I just couldn't do it. I had a bad feeling. So A, the first question is safety, and B, when you send these groups to certain areas, do you then follow up with other groups in the same location so that there's continuity of care over time?
Yeah, I can take that question, Marilyn. Actually, sorry. Marilyn, how about you let us know how safe you felt, and then I will explain what we do on the back end to ensure volunteer safety.
Well, I think we felt safe on the 3 times that we've been there. Yes, there are air raid sirens going off, and yes, occasionally you may hear an explosion in the far distance, but I think there's a major effort to keep us far enough away from the front lines that you feel safe. You know that all the hotels have shelters that you can go to if there was anything closer to where you're staying, but safety security did not seem to be an issue with us.
Okay, because my friend actually was killed. He was actually killed and was on the front page of the New York Times. That's why it's one of those. Ukraine is a little bit. It just is helpful to know that. Thank you.
Yeah, Carrie, so sorry to hear about your friend.
It was-
I'm sorry you had that loss. For us, we have people on the ground. Safety is of high priority to us. We have Ukrainian staff that are well aware, and we also have members of our team where their role is safety. So we are aware of the situation. We rotate the route that we go every month. So if we see that there's an area where it is not safe for our team to go, we will not send our team there.
Excellent. Thank you.
We felt that we were as safe as essentially every civilian, every patient who we are taking care of, so that we're at the same level of safety as civilians in a country where war can be somewhat random, in terms of what you can and can't expect, but we always felt that we were being protected.
I see we have a question from Aiden. Just for the sake of time, we'll take that last question and then we'll continue on. Go ahead, Aiden. I think you're muted.
Well, waiting for him, I might just add in a little more response to that first question about, dealing with things. We do have in Ukraine a pretty complete access to pharmacy from the things that have been recognized as the problems that, again, the hypertension, the thyroid disease, the diabetes, that what has been collected based on analysis of patients we've seen and what they need in the past is available to us when we're there.
Yeah, thank you.
Aiden, are you still there? Okay, I think he might be having some technical difficulties. Aiden, after this, I am going to email everyone, so feel free to contact us and let us know what your question is. Or Steve just suggested that you put your question in the chat, so you can type your question in. Just for the sake of time, I'm going to continue on, but Aiden, if you can hear us, feel free to type your question in the chat. So Guy and Marilynn, thank you so much for taking the time to meet with us today and to share some of those stories with us. I know it can be vulnerable to share such impactful moments with us, so we're really grateful for you and super excited to hear about what your experience in Egypt will be like. I know that you will have an amazing time there. And Roxanne's in this call, our Vice President of Global Programs. She will be with you in Egypt as well. So to become volunteers like Guy and Marilynn and experience the types of experiences they had, this is our volunteer process. You can go to our website, just Google Global Care Force, and it will pop up, and you can fill out the volunteer sign-up form. Then you will hear from one of our team members and go through the volunteer screening process. And if you are placed on a team, you will go through the onboarding process where we get your documents prepared and you go through the training as well to get ready for your deployment. And then you go and you serve and get to be with those who have little to no access to healthcare and make an impact in their lives as they make a difference in your life as well. And then when you come back, we hope that you will advocate and tell these stories about what you've experienced, just like Guy and Marilynn have done for us. So I do not see a question in the chat, so I think we can go ahead and wrap up this call. Just like I said earlier, I will be emailing everyone with the link to watch this back. We had a lot of rich stories, so if you want to come back and revisit it, you are welcome to. I will also be sending you all the link to sign up and volunteer. Thank you so much for taking the time to join us. If you want to join us again, we have these calls once a month, or you know someone who wants to volunteer, please invite them to join us. Our next call is January 16th at 11 a.m. Central Time. We hope you will join us in Global Care Force, whether that's through volunteering or maybe partnering in donations. Thank you so much for your time. Enjoy the rest of your day. Bye-bye.
Appreciate it. I'll be volunteering. Thanks so much.
All right, thank you.
Bye.